Time now for this week's Health Matters. Physician assistant Lynn Szabo, Paul Critz with you, and we have a guest in the Fug House this morning. Jermaine Brubaker, we all know Jermaine Brubaker from RX Safe Del Norte. And you've brought a little red pouch that you see those all over town these days.
That's good. I've been handing them out all over town.
Right.
Yeah, it's the opioid reversal kit. So we have these available. Open Door has them available over the counter. And it contains Narcan, which is the drug that can save someone from an overdose, for an opioid overdose only. Yeah, it doesn't affect any other drugs. It won't harm anyone. It has no dependency. It just knocks opioids off a receptor so people can breathe again.
How long have you been doing this?
4 years.
4 years.
Yeah.
4 years. So where in the community, it's almost be an easier question to ask, where won't you find a Narcan? Because it seems to be, I mean, in the school, my wife works in the library. They have it there. We have it here.
Awesome. That's good. I trained a lot of people.
Is there any place in the community you'd like to get Narcan that you haven't been able to?
Families and young people.
Okay.
Yeah, because we are seeing a lot of fentanyl overdoses all around us with young people, and I don't want that to happen in our community. So I think it's important that parents know how to talk to their kids about the risk of fentanyl. They often don't understand that if you're receiving a pill that looks like it's from a pharmacy, it may not be from a pharmacy.
Right.
And people trust that because it looks legit. But people have pill presses, and if you think you're getting Adderall or anything else that you can get online.
Lately it's ecstasy. Most of the people that tell us in clinic that they're using it, by the time we get their Utox back, there's way more than ecstasy, and there's a lot of fentanyl in it.
Yeah, so fentanyl is everywhere, and it doesn't take much to cause a fatal overdose of it either. It also seeks itself within the substance it's in. So you could test part of your substance and it could not show up as fentanyl, but because it tries to seek itself and bond back to itself, another piece of that drug could have all the fentanyl in it.
Oh, wow. So it clumps like that.
Yeah,
Oh, my
so it'll
gosh.
seek itself. Also,
well, that's interesting because that means you get a big concentrated blob too.
yeah.
Oh.
Yeah, so that's one of the things that they're finding. I read a great book called Fentanyl Inc. If anyone is interested in understanding kind of where fentanyl came from, what the background is that we're trying to do as a nation to keep it out. But it's really easy to smuggle. It's really, it doesn't take much to get here, and then it gets spread across many different things. So it's something that people need to be aware about and talk to their kids about too. We haven't had a youth overdose yet, but we are prime, and I want to make sure we don't have any in our community, and that's a big deal for me.
And I know these pouches or Narcan is in it's in the high school just this last year, right?
Yeah, so the school district at the beginning of the school year did pass a school policy to allow naloxone on campus and for staff to be able to have naloxone. There's still not a policy for young people to have it on campus or to receive it from the schools. But we know that kids aren't on campus all the time. And if they're taking high risk behaviors, trying a new drug or taking a pill, it might not be on that school campus. So we need that Narcan in our community everywhere to help save anyone. There was a incident where a nurse was driving home. She worked at Pelican Bay. There was a girl on the side of the road who was having a fentanyl overdose.
Was that just right here?
Yeah.
Yeah. No, I remember that day, and that wasn't far from us at all.
Yeah. So she decided to try a little fentanyl for her birthday and overdosed. Her friends had no idea what was going on with her. And the nurse, she works at Pelican Bay. She runs the MAP program out there, actually. And she was able to save that girl's life. And her friends had no idea what to do at that point. So it's like, we really need to get everyone informed about the high risks out there and use and carry naloxone. It should be in your car. It should be part of your first aid kit. And you can get it from RX Safe Del Norte. You can get it from Open Door. You can get it from UIHS. So it's out there. Get it.
Am I remembering from the news this week that it was also like some sort of past some sort of hurdle toward being available just over the counter?
Yeah. So and there's been a House committee meeting recently too on the higher governmental level because there are so many young people overdosing from fentanyl.
Right.
There was a parents of a 14-year-old that overdosed. I was at a conference the other day sitting at a table with someone who had an 11-year-old niece that passed, and they suspected a fentanyl overdose.
Oh my God.
That's so sad.
Yeah. Wow. So that was she didn't live far away. She wasn't in this community. We've seen a lot of deaths in under 20, though, especially in high risk areas, and we're seeing it come in. So, you know, it's not just the heroin and the opioids of yesterday.
Right.
Yeah.
Right.
And yesterday wasn't that far away. Fentanyl has really hit the market hard in the last couple years, and it's being cut into so many things that people just don't even realize. And it does put you at risk too, because maybe you think you're taking an upper, and so you're going to have a couple cocktails with it. But if it has fentanyl or an opioid in it, that can put you into an overdose as well.
Right. Wow.
So
do you
lots
have
of factors?
you have lots of anecdotal stuff, but you have like numbers for Delaware County, like how we are as far as, I don't know, the
I don't have in comparison to the state, but the number that really sticks with me that I keep telling people is we had a 363% increase in fentanyl deaths in 1 year, 2020 to 2021. I don't have the 21 to 2022 numbers, but they're high.
Wow.
Yeah. So
Wow.
you know, Humboldt County was a 350% increase in fentanyl deaths as well. So
Over that same time?
Yep. So it's hitting us hard. It's a bigger increase than a lot of other larger communities are seeing because it's been in those communities for a while.
Right.
But it hit us really hard during COVID, when there was also a lack of resources for people, and just a lot of alone time and depression and things like that. It causes people to seek alternatives.
Right, totally. I think it might also be the timing. Our community had a large prescription opioid use, and then kind of ungracefully it all got yanked away suddenly, and so people really clearly went to the streets to help with pain.
Yeah, and people will order off the black market online. So I'm not a dark web person, but I hear you can do these things, and so you don't know where you're getting it from where, and those pills are pressed to look like the pills that you would normally get prescribed, but they don't contain what you would normally be prescribed. And the labs that are creating them are in somebody's living room. It's not a sterile environment. It's not like, so there's other risks besides just that, what they could be cutting it with, and there's this new thing where people are mixing fentanyl and animal tranquilizers in a shot, and they're shooting it up, and it's actually rotting people's flesh off.
Jeez.
You mean ketamine? Are you
It's not
referring to
ketamine,
ketamine?
it's called Trank. I can't, it wasn't ketamine though. It's an
really
article I just read about this.
Oh, that's interesting.
This is a new thing. So be aware.
Can I tell about my experience?
Oh,
I had a
please.
work experience, and this is the first time that it happened at this particular work site. But somebody came in and pushing a wheelchair of a person and took him to the bathroom. And he didn't have an appointment or anything. He just kind of vaguely said, I'll pick him up later. And luckily, he said that to a nurse who was super alert. And so she noted, when that person was delivered to the bathroom, didn't seem to be coming out. She went into the bathroom and, he was unresponsive. He still had a heartbeat. His respiration rate was pretty low. We were able to get some stable vitals, but he didn't even respond to a sternal rub. And so, I, as a medical person, I said, grab the Narcan, because we all thought that was, the most likely thing that was happening. But it took a while to kind of decide that there was no downside to just treating him.
Yeah, because there's no contraindications, which means it won't interact with any other issues, any other drugs. It won't hurt anybody to do it. It just, if it's not opioids, it won't help.
Right. And so here's what I learned from it, as a health provider who kind of thought I already had this down. Yeah. So didn't. Thank you, nurses. So what I learned is that you should just go for it early. And not think about, could it be this, could it be that? I clarified I didn't have to do CPR on him or artificial respiration. And at that point, he should have just gotten treated. The other thing was that even though he didn't respond to us yelling at him or sternal rubs or, anything that you would normally get somebody's attention with in a situation like this, as soon as I stuck something up his nose, he moved his head. And so I had 4 milligrams. I had 2 doses, and I only got I feel half the dose and the first dose was only about 2 milligrams.
Mm-hmm.
So what I would do is to try and grab their head or stabilize their head. I would also say it's probably better to have 8 milligrams.
Yeah, especially with fentanyl, some people have to use more.
Right.
And
especially if there's no downside, go big or go home, man.
Yeah, I mean, you don't want to because people go into withdrawal as soon. So the more, you don't want to just load them full of 12 Narcan because you're nervous. But yeah, definitely it's better to have
the beginning
more.
dose, I think, should be more like 8. And so we're, in discussing this at my job sites, we're probably going to go for 8s or at least give 2 4s.
Yeah, because I know the state has been talking about increasing the amount that comes in the regular Narcan nasal spray. That's 4 milligrams now. They are talking about increasing it to 8 in the future, but it just hasn't caught up yet.
And that was our whole supply that we had there. I mean, I'm sure somebody could have gotten some in a clinic, but it would have taken time. The other thing, I think it's really important to note respiration rate. We had blood pressure cuffs and PO2s and stuff, but his hands were so cold, we weren't getting good oxygen readings. And I think a respiration rate would have been something that would have been like the most helpful. And that's easy to do, super easy.
When you find someone that might be in an overdose, so things that are symbols of an overdose or signs of an overdose, cold, blue or ashy if they're dark skinned.
Yeah, it wasn't that.
Yeah, and or that respiration rate that you're talking about. So if you can't really detect a breath, or they're having like those gurgly, sometimes they call them like death rattle sounds.
Yeah, he didn't have any of those.
Yeah, but if somebody is, the big thing is if they're not responding to you. So you did a sternum rub, which is where you take the knuckles and you rub it on somebody's sternum pretty hard, and it won't hurt them, but it doesn't feel great.
Yeah, usually they respond to that. He had no response, but as soon as the medicine went up his nose, like the applicator, he moved. So I would say hold on to the head, get it up there, try and get 8, at least for your initial dose. And then what I got told later by the ER nurses was try to hold his nose closed for a couple of seconds. And that actually kind of keeps the spray up there so they don't exhale and like blow it all out in the room.
Yeah, that's a good tip, as well as you should do switch nostrils each time.
Yeah, switch sides. So we did that. So I think at all the job sites that I work at, they're going to be looking at this and seeing how we can do it better, because it's occurring to people that this might happen again, and that's not a good idea.
So are you talking about establishing some sort of like standard operating procedure then, as far as
learn from our mistakes, move forward with something better? And then the other part of that is, of course, the ambulance was called. Ambulance codes are confusing to the receptionist who calls. It's usually the person who grabs the phone is the one with the fewest medical skills. Not that they don't have a lot of education and common sense, but oftentimes the question is posed to them, do you want them to come code 1, 2, or 3? Now, I would think 1 sounds like get here as fast as you can, get here. But actually, in some jargons, that's the slowest. Come after you're done with your breakfast at Denny's, no problem.
Oh wow, okay.
And so that disconnect in communication has made they already have to come out from Smith River most of the time. Has made the actual arrival times really slow. And let me tell you, it was awful. I was screaming at everybody to get the damn ambulance there. Oh, wow. And of course, that was ineffective.
Was it because of a miscommunication over the codes like that?
I think there might have been another call going out, because we heard the ambulance, got all excited.
And then it kept going.
And then those, my job sites are kind of near the hospital. It's not an unusual sound, but I don't remember the ambulance that arrived. I don't remember sirens. It's possible I missed them, because we were kind of buried. The bathrooms at the clinic sometimes are not, easy to monitor, or not, they're kind of tucked away in corners and things architecturally. So, maybe I just didn't hear it. But that's been a problem that I've had before. Is I'm expecting a rapidity of response that for some reason is just not going to happen.
Right. Wow.
And it's horrible. So having more Narcan on hand would have been helpful. So
okay, so I guess, Jermaine, how do these work then? What's in this pouch?
So the pouch, the opioid reversal kit that comes from our Safe Del Norte, we have a CPR breathing mask, we have gloves, we have instruction kits and a resource card, and then the Narcan itself. So it's in this little box. It has the quick and dirty instructions on the outside, and that's the most important thing is, identifying the overdose, like we just talked about those signs, especially if they're not responding. You can look at clues around where they're at. You can see that's what happened with that nurse on the side of the road. She was able to see what there was paraphernalia and such. And then you're going to do the nasal spray in the nose. We recommend rescue breaths as like the gold standard. That's why we have because what happens with an opioid overdose is it affects the brainstem and stops that breathing or slows it way down. So that person isn't getting oxygen. The most important thing is getting this medication in them, though, and calling 911 as a backup, because this only lasts for 30 to 90 minutes. It knocks the opioids off to the receptor, but those opioids could still be in their bloodstream. And especially if they try and use again, because they're going to go into immediate withdrawal symptoms. If they're a regular opioid user, they're going to feel really shitty.
Wow.
Yeah. It's like the worst flu in the world times 100. So they're going to want to use again to feel better. But if they do, they can go straight back into an overdose, because these will block those receptors for 30 to 90 minutes. But once they come off those receptors, there's still opioids in the bloodstream, so you could go back into another overdose. That's why we recommend calling 911 and telling people not to use it.
So you administer the Narcan, and you've got, or I'm sorry, you've got the different names. I keep throwing out
Naloxone. Narcan is the brand name.
And is naloxone
naloxone's
Okay, yeah. For us here in Del Norte.
Yeah. It's interchangeable for the most part.
But you can, so if you administer this, so you're saying that, after, whatever, an hour, however long this is effective, they could come out, they could either go back into overdose, depending on what's happening in their blood, or go immediately into withdrawal?
They'll go immediately into withdrawal as soon as you administer the Narcan.
Oh, wow. Okay.
If you get enough of it in there. This guy kind of became more responsive for a couple of minutes and then didn't.
Okay.
So you have to get enough in there.
Wow.
Yeah.
So if they're not getting responsive, increasing their level of consciousness, there's probably one of two things happening. You don't have enough Narcan in, and again, go big or go home, or there's something else confounding the situation.
Wow.
Which is why you want to call 911. And we tell people to check airways too, because sometimes people will have aspirated, unfortunately, which means you throw up and it gets stuck in your throat.
Right.
But unfortunately, Narcan doesn't knock that out of their throat. But just if the Narcan isn't working, you can go back and check the airways, do a sweep. I was also going to say, I forgot what I was going to say, actually.
Well, I derailed you too. We were going through the what's in the
what's in the kit. So really, it's a nasal spray. So and it feels like you're not doing anything. So don't test it first. That's my big advice for people.
Wow, okay.
Because it's just a little nasal spray that goes up into the nose, and it won't feel like you're doing much, but you are. And it's important to, switch nostrils each time, like I said, when you're administering it, and stay with the person if you can.
So what is the administering of the Narcan, of the naloxone? What does that look like? If you do one time in one nostril, I mean, walk us through a hypothetical situation.
Yeah. So if you're like coming across somebody similar to what Lynn did, I usually would check and make sure, do the sternum rub. We use scare me as our acronym. So S is stimulate. So you're going to try and stimulate them. You're going to yell their name. You can shake them a little bit. Don't assault them, but no hitting or punching or anything else. And if they're not responding, you can assume that it's an opioid overdose, especially with those other symptoms we were talking about. And then C for in the scare me is call 911. You want to get that call in right away. And just so you know, there is a Good Samaritan law out that protects people who are calling 911, that if they have a usable amount of a substance on them, they should not be arrested for that. So we know that this person was dropped off at the clinic back in the early days where people were overdosing, and long time ago, people were just being left by themselves, or just dropped off at a hospital or a hotel, some place where they thought they might get in trouble. So don't worry about getting in trouble. There are laws that can protect you. It's more important to get this person safe and alive.
That's interesting. I did not know that. Wow.
Yeah.
Okay. So what's the A stand for?
A is airway. So we've stimulated them. We're calling 911. And then we're checking that airway. So again, like I said, they could have aspirated. So you just kind of want to check and make sure there's nothing in the airway blocking it. You're going to look, listen, and feel for breath. And if you don't feel any breath, or it's really shallow or low, then we're going to do R. You can do R, which is a rescue breath. So it's 2 breaths every 5 seconds for 2 minutes, 2 for them and 2 for you. And this is the gold standard. I know a lot of people aren't super comfortable doing that, and that's okay. But it is the gold standard. Basically, if you can do it, that's why I put CPR masks in here. So especially in this time of communicable diseases, right. We want to make sure that people are safe.
I'll just throw it out there that a normal respiration rate for a normal healthy adult is probably about 14 to 20. Maybe 12 to 20 for an athlete. So if you got somebody who's doing 6 breaths a minute, and you only have to count for 30 seconds and then multiply by 2. So
so it doesn't take long to check that.
To figure it out.
Yeah, that's good to know. I'll put that in my trainings in the future.
So is there a mask in there?
Yeah, there's a mask in the bag. It's just one of those little keychain CPR face shield guys.
I have no idea what that is.
Yeah, so it has a one-way valve on it. It's just this little piece of plastic, basically.
So it's like a dental dam for your face.
Yes.
Yeah. Okay.
Yeah. It is.
I'm glad you said it.
Dental dams are kind of for your face.
I guess so. Yeah, that's right. Yeah, good point.
Yes. So that's the R. So you're going to try and get oxygen on board to them, especially if you've come across somebody that may have been there for a while. That will be important. But the next step is if you've given those rescue breaths, reevaluate. Is their color coming back? Are they starting to respond? Did that take care of it? If not, then you're going to go into medication, which is the M of me. Okay. So we usually tell people do one, wait 30 seconds or so, give a couple more rescue breaths if you can, and then do the other. But with fentanyl these days, like Lynn has said, go big or go home. Feel free to do both nostrils first.
Okay.
Because fentanyl, for lack of better terms, is stickier than other opioids. So it has a stronger pull to those receptors. So it takes more naloxone to knock it off those receptors.
Oh, that's good to know.
Now the applicator.
Yes.
Single. I mean, I've never done this. So I mean, it's a single shot per time. You've got
So there's 2 blister packs in a box. This is how it comes from the state of California. And if you're interested in getting Narcan, I can help you with that. We have it at RX Safe Del Norte. If you want a training for your staff or your family or anything like that, we can do that. I can also help you get set up with the state of California to order it if you're in a business or a agency that wants to have some for you and your staff. It's free from the state of California. I mean, there's just a few pieces of paper you got to fill out, and I can help you with that. But they come in these little blister packs. So they're you can toss these in the car. Heat doesn't matter so much. Freezing matters and sunlight matters, but they're in opaque packaging, so that won't affect it. Also, it's good to know it does lose some efficacy, so it's not quite as strong after the expiration date, but people are using it up to 5 years after expiration date and still having it be effective. So if you have old Narcan, don't throw it away. If you'd want new and you want to trade for old with me, I'll trade you too, because I have people that'll take it.
Wow.
Yeah, so it comes in these little blister packs, and you just open it up.
It looks like a little bottle of Afrin.
Yeah. It's basically just like any nasal spray you would use. You just put your fingers on the top of it, put your thumb on the plunger on the bottom, put it into their nostril, and press. It's pretty simple.
One time. Now you can use these more than, I mean, in one situation you use it more than once, right? It's not a single
so there's
use
2 per box, 4 milligrams each. So if you suspect it's fentanyl, go ahead and do 1 in each nostril to begin with, and that's 8 milligrams, like she recommended for a start. Yeah.
So I guess what I'm wondering is if I open, because I want to go through, I'm going through what would stop me, what I don't know, like if I were in a situation. If I open up one of those, I use the initial 4 milligram dose in one nostril. Is that one done?
Yeah.
Okay, so it's just a
it's
single use.
Single use, one
Gotcha.
time. There's only 4 milligrams in
Okay.
there. And like I said, it'll feel like you're doing nothing because
Right.
it's a nasal spray. So there's no spring or anything like that in it to like give you that satisfaction. But so just use a new one each time.
Okay. And so let's say, something's going on. I mean, and I guess if you've gone through in a situation with somebody down and you go through all the Narcan you have and nothing happens, then
Hopefully 911 gets there.
Yeah,
So
yeah.
Well, then you're into artificial respiration and CPR.
okay, what would be
Yeah.
the next step then would be to
Yeah.
continue the breaths of the CPR.
Continue the
right?
breaths for as long as you can. Get that. All first responders in our community carry Narcan on them. All law enforcement, all ambulances. So if you can get any kind of backup there to help you, that's going to be helpful too, because they will have more Narcan on them as well.
Right. Wow.
Yeah, because I mean the box is kind of bulky. I take it out of the box for me personally and just carry the blister packs because it's a little less bulky.
Although the box has really clear instructions.
It does. They have instructions in each of these little blister packs now too.
Okay.
Oh, I just threw that one on the floor. They're very light. Easy to carry in your purse, easy to put in your glove box. And like I said, it only takes a little to save somebody's life. So, it's not a bad idea. You never know who is going to have an overdose. Like, it's not, people often think of people that use opioids as a certain population, houseless, obviously in like deep in addiction, but that's not the case. We have a lot of older folks that are having overdoses. Our grandmas are, and often it has to do with either they got taken off a pain pill, so now they're trying to seek it in other ways and don't realize that fentanyl is in everything. Like you're getting it from somebody. It looks like the pills you used to get from your doctor, but it's not the pills you used to get from your doctor. They can look like that, but they're not. Or, let's say you're cooking a big meal for everybody. You take an extra pain pill because your back's really hurting.
Yeah, and you go.
And you sit down and have a couple glasses of wine with dinner. You can go into overdose. Alcohol mixing, any kind of downer mixing.
Benzos, sleeping pills.
Yeah.
Huge big problem. There's a lot of people on Ambien.
Yeah.
And
And
that
so
would be a
that's what you
problem.
really need to look for is those mixing. And we're seeing a lot of people seeking fentanyl now. Now it's not just like, oh, I'm accidentally ingesting it. People are actually seeking it as well.
Yeah.
I have a question, and maybe actually both of you can answer this for me. And it's there's a lot out there about fentanyl exposure fentanyl exposure, and I've tried to research it online too because everybody's I'm in the same room with fentanyl. Oh no, I need Narcan. I'm feeling weird. And then other times I read, it's got to be aerosolized for a number of hours to get. How easy are those things where law enforcement come in casual contact with fentanyl and then have to go, take a knee? Is that real or is that
A little bit. So there is some myths in there. It can't be necessarily absorbed through your skin as easily as people think it can be. Mostly people are overdosing from inhaling it when it is in the air, but also it likes mucous membrane. So if like you touched it ungloved and then rub your eye, pick your nose, like you could be transferring that fentanyl into your system. So that's where there's a lot of, and you don't want to vacuum it up because that's going to aerosol it, right?
Yeah.
So being extra cautious. There's a lot of stuff out there for first responders and other people. There's tips out there to how to handle fentanyl. Also, you can get fentanyl test strips to know what you're dealing with in a lot of different ways. And those are also available at Open Door over the counter or from RX Safe Del Norte. So know what you're using. But like I said, it could seek each other. So
yeah. It can
always
kind of
start small. Like you can always do more, but you can't do less, right? So, and make sure that you have Narcan on you. We know, people have been using drugs since we figured out how to ferment fruit, right? In the caves. So it's part of people seek things that make them feel good. And unfortunately, these things can kill you very easily these days. So just be informed. I think about my friends. I hand out Narcan to everybody before they go to a music festival, because people who aren't usually using drugs and do it for like an occasion don't know the risks that are out there.
They have no idea. How did they get a hold of you to get some?
So you can email rxsafedelnorte@gmail.com. We also have online trainings on our YouTube page, so you can go there and watch the videos and fill out a quiz, and I'll drop it off on your desk or your front porch.
Is there a way to link it up if this goes to YouTube?
Well, yeah, when it goes to YouTube, we can certainly put the links on. The links won't do a lot on the radio.
No.
But is it just rxsafedelnort@gmail.com?
Yep, that's
Okay.
us. And then that gets a hold of me. And then you can also, we have Facebook, we have YouTube. So those are, and we have a lot of different videos out there about harm reduction. And we're working right now, I'm working cross with Humboldt County on getting more fentanyl awareness for families and youth as well. So we're working on how can we get into spaces where youth and families are to talk to them about this, let them know the risks and how to talk to their kids and how to get Narcan in your home, because you never know. And like I said, we've lost a lot of young people in the county surrounding us. And my goal is that we don't lose any here.
Yeah. Wonderful. Jermaine, so there's
Jermaine.
a RX Safe Del Norte website someplace? Where's the central place to go to find out? You've given us a couple of different options.
Yeah, we do have a website. It's going to be reworked soon.
Okay,
it's not fantastic.
Yeah. I think I've seen your Facebook like WordPress post or something. Is
Probably.
it so like just pulling your hair out? Yeah.
Yes.
I know that too.
I'm good at a lot of things, but not at everything. But our Facebook is really up to date. So I know a lot of people in this community pay attention to Facebook. Pay attention to our Facebook. We'll have events coming up. I'm probably going to do a countywide Narcan training soon. I got 1,200 doses of Narcan. Wow. I gave out 600 last year. So my goal is to double that. I gave out 200 at the point in time survey.
Nice.
And I wasn't the only one handing out Narcan there either. So we are really, and in Humboldt, they're seeing a decrease in overdose deaths of the homeless population because of all the good outreach we've done with that area.
That's great.
Yeah. So, we're hitting that. We know how to reach people that are on the streets, but we need to get families and young people, businesses. If you own a business, have Narcan at your front desk. You never know. And people go into that overdose so fast.
Yeah.
It's scary. That's why we use that scare me. But the big thing is just keep somebody alive.
Super scary.
Yeah.
Anything else, Lynn?
No, thank you. I appreciate it.
Yeah. Thank you, Jermaine.
Thank you. Thanks for coming, and get a hold of us. Get that Narcan.
All right. We'll see you next week then with the next Health Matters.